Mayor Walsh's coronavirus update.
The Boston numbers as of yesterday, recorded COVID cases, 13,723 cases. That's an increase of 50 from Friday. About 16 new cases per day is what we're averaging here in the city over the last week or so. 9,710 people have fully recovered, an increase of 27 from the previous day, and 715 people have lost their life due to COVID-19. And our thoughts remains with the families of the loved ones that are still struggling with this illness and families that have lost their loved ones due to the COVID-19. Phase 3, Step 1 of the state's reopening plan launched in Boston this week on Monday. On Friday, I provided an overview of the city programming and the business guidelines dealing with Phase 3. You can find those resources at boston.gov/reopening. I do have some updates today on how we're moving forward. But first, I want to emphasize again what's in our mindset needs to be as we take these next steps. Right now, the United States is the worst place it's ever been in dealing with the pandemic, where our numbers are. The California governor yesterday had to shut down indoor businesses for the second time in the state of California. A tough blow to that state's economy, but no doubt a necessary and important step. There's even worse situations that we're seeing coming out of hospitals in Florida and Texas and Arizona and other places in the country. And quite honestly, all of this closing down and all of this infection rate is devastating. Here in Boston and in Massachusetts, we need to do everything we can to avoid going down that same path that many of these states and other cities in America are going down. The Boston Public Health Commission and the City of Boston are monitoring the data every single day as we get it. We're monitoring test results. We're monitoring positive test rates. We're monitoring hospital activity and the neighborhood and demographic differences of all those numbers. We are ready to make whatever adjustments that are needed, but we all have the ability to influence on what happens. We all must accept that responsibility. We've been saying it from the very beginning. In Boston and Bostonians, you've been doing an incredible job. We've worked our way into a strong position to control our own destiny here in Boston by precautions that we have taken. But as soon as we stop doing that work and taking those precautions, we are at risk of moving backwards. So these first weeks of Phase 3 are very critical. Every day is certainly critical. Every time you leave your house, I ask you to think about what you're doing to prevent transmitting this virus and protecting your family and the community. We're asking questions like, are you wearing a face mask? Are you staying 6 feet away from other people and avoiding large crowds? Are you washing your hands as often as possible with soap and warm water and cleaning down surfaces? Are you operating your business or your workplaces with absolute caution and care, following all of the requirements that have been laid out by the city and the state? Are you listening to the concerns of your coworkers and customers and consulting the guidelines at boston.gov/reopening? These are things that every single person in our city should be doing every single day, and we are ready to help with any guidance that is needed. That's how we've approached City Hall and other public facilities. Since March, we've made it very clear we'll keep all essential services available while protecting the health of every worker and every visitor. We made sure that many services as possible are online. We've kept 311 staff to answer whatever questions residents have or assistance that they may need. And City Hall has been open on Tuesdays and Fridays by appointment for a variety of in-person services that people need. That system has worked well, and I want to thank all of the employees and residents who made that work. Today I'm announcing starting next week on July 23rd, we're going to move forward more carefully. We will start to open City Hall on Thursdays, providing in-person service 3 days a week on Tuesday, Thursday, and Friday schedules. Services will continue to remain by appointment, so you must call ahead to the relevant department to make the schedule appointment that you might want to see. You can call, if you're looking for a phone number, you just simply call 311. As you might be able to see behind me, we'll continue screening everyone who enters the building for COVID symptoms and elevated temperatures. At the same time, as I announced last week, despite state guidelines allowing larger gatherings, we will not be hosting public or private meetings in City Hall or in any city building. We'll continue to provide online meetings and other ways to make your voices heard.